Hello, everyone. Good morning, good afternoon, good evening, depending on where you are in this world. I'm so excited to have you attend today. Would love to hear where everyone's from in the chat room or the chat area of our Zoom meeting. Also, you're able to put your questions there so that we can answer any questions that you may have about American Accreditation Association or the topic that we're talking about today. So very excited to get started and celebrate Mental Health Awareness Month as we just passed the day a couple days ago. It's very exciting on that. My name is Wendy Danacourt, and I am um, the head of the healthcare accreditation here at American Accreditation Association. I do have a background in social services and mental health for quite a number of decades. So this is a topic that is close to my heart, and I feel it's time that the accreditation associations around the world and universe take notice of what we can do in our mental health world to better serve our patients as well as our employees. But before we jump into all the mental health information, let me tell you a little bit about American Accreditation Association. So we're an internationally recognized organization providing accreditation across a number of areas, including healthcare. Our headquarters are located in Virginia, but we do operate internationally with the office also in London, United Kingdom. And we are operating in, it says 52 countries here, but I think that's gone up just the past couple months to 54 countries. So that's very exciting on that part. So we have a quite range of reach and interactions with different areas of the world. And so what our strategic objective here at AAA, we are committed to providing international accreditation that really inspires confidence in the quality of the services. So in this case, healthcare and mental health care, and the acceptance of results from accredited organizations and the protection of health, safety, and environment of the public. So really challenging healthcare providers to increase their quality, the patient safety, and overall outcomes on that. Also, we want to promote the acceptance of accredited results and certifications internationally amongst our global partners as well to share that they've done the hard work of achieving international accreditation on that. And then continue to strengthen operations, develop the capacity and capability, exceed the expectations of our customers and stakeholders, and deliver accreditation services to the highest quality and technical standards. So I mentioned we do quite a bit of accreditations. So of course I listed healthcare accreditations up there on the top. We are accredited by the International ESQA standards. So the highest standards that we could possibly achieve, we achieved that so we could help others achieve accreditation. The other areas that we work on, and I'm going to see.
طيب احكي لي والله ايش يعني
Dima, can you mute? Because we're getting your background. Thank you. Oh, let me go back there. So the other areas that we provide accreditation in are for schools, Department of Education standards, laboratories, accreditations, again. And we list a couple of the different standards that we work with and focus on the certification there. Training and education providers accreditation. So That's criteria for institutions that are focused on providing training and educational materials to others on that. So that's pretty exciting. And often we see that hand in hand with healthcare. And inspection body accreditations through the ISO 17020 and certification bodies accreditation ISO 17021, 17024, and 17065 on that. So with healthcare accreditation, as I mentioned, we're very proud that one, we're members of ESQA, the International Society of Quality and Health, um, for health for quality in healthcare. But we are also are accredited slash certified by them to provide the healthcare accreditation worldwide. And really, again, focusing on patient safety, quality of care, and really making sure that there's high dedication to overall care of the patient. And part of what we do there is we look at the full entity, the full body of work of what the organization is able to provide on that. And because we do it by the service that they provide, we're able to look at a wide range of entities to provide accreditation to, and that includes dialysis, ambulatory surgery, private clinics, polyclinics, dental treatment, ophthalmology, community pharmacy, um, medical tourism, regular hospitals, behavioral health centers, behavioral rehab centers. So if it's inpatient or outpatient, or even telehealth across the field, we provide international accreditation for that on that piece. And a big part of what we do, oh, I'm having tech problems, is that we meet the consumers where they are, the providers where they are, understanding that not everyone has the same technology capabilities, have the same resources across the globe. So we work with the providers where they're at, and we're very proud of that. So that's it for American Accreditation Association. So let's start talking about the global standards and impact mental health and accreditation on the world stage. So really here we want just to give a brief overview about accreditation standards, how it might impact mental health, adapting framework to meet local needs, if this was a longer talk, we would go into some major case studies. And if you want to learn more about those case studies, feel free to reach out. But exploring innovation and learning on this. So learning on the agenda of global standards, how do you locally adapt those global standards? How does innovation and ever-changing world that we're experiencing impact that? And the ever-changing policy and advocacy that is happening, especially around mental health. Since I've been in the field for a number of decades, I've seen the change and seen how stigma around mental health has really decreased. We still have a long way to go on that, but now it's more accepted. I actually just saw this morning some data showing that in some areas, mental health visits were higher than visits to an individual's primary care physician on that. So that was a little exciting. And then of course um we'll have a closing discussion and question time for our agenda. So as I've said, mental health has been big part of my life, providing treatment and seeing things, but still it is a big impactor in this world globally. It's been noted by the WHO that at least 1 in 8 um, live with a mental disorder of their own. So that is not even counting individuals who may live with someone else that has a mental health issue, disorder, or diagnosis, because there's impacts on that as well. And suicide is the second cause of youth death across the world as well. So large impact across our populations, but yet healthcare spends less than 2% of budgets to address healthcare needs. And that's not even counting any type of prevention needs to try and stop mental health and depression and teaching coping skills. This is just about the treatment. So once it's been identified, what do we do with that? So less than 2% of our budgets is really on that. And our hope with accreditation is that we can help bridge standards and practice to help demonstrate the need through quality monitoring, data information, also provide a structure so that those individuals paying for services will help support and continue to pay for those services on that. And it continues to get the recognition that mental health deserves and the importance that it is on our lives. And we've started seeing that in the past. I want to say since COVID, because mental health really became to the forefront. Many more people were experiencing it. We were seeing people starting to talk about it. The stigma was lessening, and now many healthcare entities are trying to embrace how they can treat it and get services to the people, often through telehealth or other technology. So that, of course, piqued the interest of some venture capitalists and entrepreneurs. So we're still getting the attention of mental health. And my hope is it doesn't wane and another issue takes its place and focus off of it, but we continue to grow and explore how we can help. But one way we can definitely help is bringing um, legitimacy to what you do in mental health treatment, because if it is a hot topic, if I can use that term, or getting great money, there will often be individuals that take advantage of that and take advantage of vulnerable people going through mental health issues, whether it's depression, challenges with drugs, anything like that. So we do have some bad players there in the world, and with the excuse me, with accreditation, that lends more to the professionalism of mental health treatment, the quality of mental health treatment. When we look at standards, we're building in of looking at how are you using data? What is the data that you're looking at? Making sure that you're doing things ethically within your region of how to treat someone. So we're just supporting the high quality, patient focused, patient centered, and patient safety on that. So with American accreditation standards, excuse me, one of the first things that we look at, and our standards look at, is how do we treat the patient? We want to ensure that we're treating the patient with dignity and respect, wanting to make sure that the patient is the focus, not where's the money coming from, how much money we can get from someone, but really where is the patient at, what can we do to help them with their mental health issues, is this provider the best provider, are there other providers that they could be working with, and also how do you do that with the respect of their culture as well. We take that into account when we're looking at our standards at American Accreditation Association of what culture the patient is, as well as the culture that the provider is providing the services in that. Another big portion of our standards is safety, both safety for the patient as well as the provider, as well as the family and community. Are there steps continuously being followed? Part of the practice, if you will, of how do we do our utmost to protect the patient, both from their self, as well as from others, as well as if they're on any medications or anything like that. How do we monitor that on that piece? How do we protect our providers? Because we do know that on occasion, mental health patients can become violent or extreme, and so we want to make sure the all of our staff and the providers are safe as well when we're providing mental health treatment. Safety of the family members. So, what do we do if we do find that a patient becomes challenging or a high risk? What are the steps? And do the steps include the family? Do the steps include the community? What can you do in that community or that region to help protect the patient as well as their family on that? Another area of our standards, and I've alluded to this before, is continuous improvement. So monitoring. It's one of the newer things in mental health of collecting the data and actually actively looking at data of going, what is working? What is not working? What do we need to change? And I think that is something that's very important in our field as the world around us and the treatment in mental health is ever changing. And what I mean by that is, and I'll use, well, for mental health, such as depression and whatnot, the way people are identifying that they're depressed is changing. The way that they're presenting their symptoms is somewhat changing as well. But leading factors um, to depression are also changing. We have technology, which is wonderful, but technology also brings in some unrealistic expectations. If you go on many social media platforms, um, everyone has a perfect life because many people don't share all their reality. Or they just share the perfect, or they just share the dark side of their lives on that. And now we have technology of AI. And I don't know about you, but I did have a social media platform that I went to so I could feel good because it was all funny stuff on there. But now I can't tell what's real and what's not real. And that goes on into the news that we get, what's real news, what's fake news. So ever questioning, which then becomes overwhelming and creating anxiety of what to believe, what not to believe. And that I will share that's just me as an adult. So imagine younger individuals not going through and exploring if things are real or not real. So they're taking everything at face value. That really impacts their psychological outlook and their beliefs and their values and things like that. So that's impacting their mental health as well with the AI and bombardment of being on social media, things like that. And we're having our many young children are on technology so that they're being exposed, not necessarily to all those platforms, but they're being exposed to the technology and believing that it's the place of truth because they're have the exposure at school, which is supposed to be a trusted area, but then they, happen to get on mom or dad or older sister's tablet or phone and start looking at funny things. And again, it's always happy things. So then they don't know what to do or how to manage the reality of the world going around them. And when things aren't perfect, how do they cope with that? And the coping skills that us older generations learned from our parents, from interactions, from just our daily lives on that. They're not getting that because they are glued to the screen on that part. So part of what we need to do, and we support with the standards, is looking at continuous improvement, which is looking at the data, why looking at why patients are coming in, what's leading them to you, how is it going? Are they continuing to show up, which is good, or did they drop off? When are they dropping off? So that you can flex your services to meet the needs and what's happening in your environment. Another reason why continuous improvement and looking at that data is important is so that you can actually use that data to help you forecast things. I was working with one provider and we were collecting a lot of data about who is coming in to a drug and alcohol treatment center. We started noticing um, that we were getting younger individuals using harder certain drugs or medications that they were buying off the street. And so we started looking at that data and we were seeing a trend of younger individuals using prescribed pain medications or opioids and mixing them with benzodiazepines and then mixing them with their stimulants for ADHD, typically prescribed for ADHD medication. And we were seeing that and we trended that out so we could adapt our treatment services and train our staff ahead of time of this is what is happening in our community. We need to be prepared and treat it head on rather than wait a year to look at the data and go, oh, well, it's changed now, but that was 9 months ago. And so all the patients that came in during that 9 months didn't get the modified treatment on that piece. And data is wonderful because you can then get outcome data, surveys from your patients, how well you're doing, what do they enjoy, what resonates with them, um, what um, reasons why they might drop off, reasons why they continue coming, that they're getting better, they're going back to work, going back to school, feeling like they have a better relationship, feeling happier, all of that. So continuous improvement is not just about business and growing business, but it's about the patient's lives and your therapist's lives as well. Another one with that we're looking at is integration with primary care. Very important part. And I want to say it's probably integration with any other medical field because if you address the mental health early, you can almost stop. You may be able to stop it, but you could slow down any of symptoms of depression, anxiety, things like that. You can interrupt it. And that happens in other areas such as oncology, a patient getting a report that they have cancer, how do they deal with that? How are they dealing with the chemotherapy? What kind of impacts is that having on their lives? So it's important that mental health is integrated, and we look at that with our standards, both when we work with those other entities like primary cares, clinics, hospitals, pain management centers, of how do they integrate with behavioral health and other organizations, but also looking how does the mental health provider integrate into those and work together. I think it's very important to be open and honest with the primary care because that's usually the first line of defense of physical symptoms. So then being aware of mental health areas that are being addressed is important knowledge for those primary care physicians to take into account when diagnosing for those physical symptoms as well. And then we've got the telehealth and tech readiness. So I talk, and as much as I talk bad about tech being impactful on the mental health, it does have great usage. We get to talk today. We know about telehealth sessions and the telehealth can be done on a one-on-one basis, can be done, you can do group therapy. It's wonderful when there's family or couple sessions as well, because even if, say, my husband's traveling and he's in another state and we had a marriage counseling session scheduled, but he's out of state, we can still do that with technology, which is very great and wonderful on that. Technology can also be used to help track symptoms. and encourage people to work on their goals so that they become accountable. They can share their accountability with you as a provider or with their other providers, putting it into healthcare records. But you can see overall swings, what's going on. Also, the beauty of all the technology is you can look at different areas of how does that impact someone's mental health, but also how can it be a predictive factor. So, many of us have smartwatches or smart devices that track our movement, exercise, sleeping patterns, things like that. And that's a great way, data that you can look at to help identify, oh, Wendy stopped walking. It's been 2 weeks. Something might be going on. Do a check-in. You can start seeing depressive symptoms coming on and really address, well, what happened 2 weeks ago that you're no longer walking and really integrate that into your services. So I got individual ones on all of these. So protecting rights and minimizing harm, again, big part of what we do in accreditation, but a big part of what we do in mental health as well. We want to treat our patient, make sure their safety. And really what we do and in mental health, what we have done well before it was put into standards and requires was really the inclusion and fairness of providing services to all populations and all people. So equity is very important in treating mental health. Unfortunately, mental health does not pick only certain populations to work with or certain social classes or anything like that. It impacts all of us across the board and across the world in some manner. So it's an important area to look at to either improve your healthcare system that you already have, enhance it in ways, opportunities to work together in partnerships in other ways. So data driven, I think I kind of drove that one home. Integration across healthcare services, very important of things that we look at in the AAA standards on this. So just some of the other technology, we talked about telehealth, talked about AI. You can do it remote. There are virtual care protocols that are done. And again, you have to think outside the box. How do you, and remember, you still want to keep the core areas of how do you keep individuals safe on that, both from the provider and from the patient side. And then how do you work with other organizations as well and using that technology to share information, but doing it in a safe and secure environments. Security is another one when you talk technology in mental health because we is such a precarious information that you're maintaining. So we do want to ensure that security level on that. So we look at local realities as well. So with mental health, we have cultural differences on how we look at mental health issues. And remember, I and talking about whether it's depression, anxiety, addiction. Some people put autism in this area. So really, it's any entity of that. Um, how does our culture embrace it? And then what's the stigma? And how do we work to address that stigma and try and lessen that stigma on that piece? That is definitely one thing when we come in to do an accreditation for a mental health clinic or provider that we look at what are they facing? What are those challenges that they're facing right off the bat? And how are they addressing that? So if it's a high stigma region of mental health that it's considered taboo or poorly for someone to seek mental health services, does the provider have giant letters on their door saying mental health provider, and that's the one that the patient has to walk in through, or is it a nondescript door that maybe just has the address number? People may know what it is, but at least it's not, you know, in neon lights saying what it is when it's a community that looks down on mental health issues. So another thing that we have to look at and we take into account are what are the law and regulations that mental health providers have to work within when they're treating that. And those vary so much, region to region throughout the world. And here in the United States, every single state has raw laws and regulations that are specific to the state, but also specific to the type of provider that it is. So psychologists have their own laws, psychiatrists has their laws. We have social workers, mental health counselors, addiction counselors. They have all their own laws and regulations. And I know many regions there aren't any laws and regulations, which can be a pro or a con, right? Some people see I can do anything. Some people see, oh, I can't do anything at all. So how do they work within that? So I always encourage people to know their laws and regulations, but also become a voice in those laws to help change those that may be outdated. I worked in one country, their regulations hadn't been looked at for over 30 years, and we've had a lot happen since then. As I mentioned, COVID really brought mental health to the forefront of conversation. And so there were no changes there, and they weren't keeping up with the times on that. So worked with advocacy groups to help change that. But that's an important part, an important reality that we have to look at. Another reality is workforce shortages. There aren't enough people to provide the services so that patients and people in need can get the help immediately that they need on that. So that becomes a challenge because it's not being addressed. The patient could internalize that to mean that it's not important or oh, I should just handle it. But the biggest part is when somebody reaches out for mental health, that's the important time to get them engaged into services so that they just make the next step. And that next step might be we stay on a phone call, we have a conversation, um, you make an appointment for tomorrow, you show up to that appointment tomorrow. But in reality, the workforce shortages that we're seeing worldwide is you don't get that appointment that same day or the next day. It could easily be 30, 45 days out. And by that time, the world has changed for the patient of where they're at. They may be feeling better, so they don't think that they need it anymore. Um, and so then they don't show up and they don't reach out again until it's another crisis. Or they continue to feel bad. It's manifested to something medically and they've gone to their primary care and their primary care is starting to address their mental health issues. Or it may have gone to such a crisis that they end up in a hospital emergency room, and that's not the best use of the services. And we definitely don't want individual to delay services and have individuals go into crisis on that. Another piece is finance and insurance. How do you get mental health services paid for? How is it covered? How do we pay for the workforce that we're trying to recruit to address that shortage? Things like that. Where's that money coming from? And in today's world, money is tight everywhere. In the United States, we have health insurance companies that pay for the mental health care. Canada, UK, other social have government entities that do, but still, it's a limited amount of funds. It's not an ending fountain of money that they can go to. So they have to work within the realm of that. So how can they best serve that? So and some of the things that they've done is that they've gone through innovations of what can they do. Um, I have some on here. I should have listed that we actually in behavioral health started creating curriculums in mental health so that it was very clear of what the next step therapy sessions were going to be. How do you address this? Great outcomes. And it was brief therapy, maybe 5 visits or 7 visits to help someone and give them the skills to continue moving on, feeling better, so that they could then continue therapy to look deeper should they choose that they want to do that. But it was, that I feel like that was one of the first innovations that we did. We've also been innovative of who can provide therapy. Back in the day, when I was a wee child, it was you had to have a PhD, MD to be considered a real therapist. Now it varies, and we've been, even have so people may have university degrees, professional experience certificates, and now we've explored and have seen the benefit of using peer support. So individuals who have gone through similar situations, but they have been successful in turning their lives around, using coping skills, things like that. They work with the people in need as well that have mental health or substance abuse issues, and they've been very successful on that. So those are ever changing. The peer support in addictions, informally, we've had it for decades, but have formalized it so it's seen as a professional um, opportunity where there are opportunities for certificates and even degrees in peer support, so that it is seen as professional and recognized, so then it can get paid, and we can continue supporting those individuals that want to be peer support. But so we've been very innovative. And of course, with, as I mentioned, COVID, telehealth came around, quickly learned that telehealth needed standards. So what are the standards and expectations, both from a patient side as well as a provider side, as well as the technology side on that. And now we're seeing AI being used. And so there's a lot of talk about ethics in AI, guidelines of when to use it, how do you monitor it? Because the challenge with the AI is it continues to learn from itself. And you have to be able to monitor it so it knows when it misinterpreted things, so it doesn't learn the wrong things. We've heard the horror stories that AI has told individuals to harm themselves, things like that. So it's still a very new thing, so it needs to be monitored. There needs to be a lot of guidelines and open dialogue on what the ethics are around that. So that's an important piece to have in your practice and considerations, and knowing where your AI was developed, or any technology that you're using, where it was developed, to make sure it has the same type of security levels that you're comfortable with in your region, or that your region requires as well, is an important piece on that. And you as providers, if it's all providers out there, it'll be very important for you to monitor and lend your voice to when your region starts developing the standards, which they will start doing around AI and the use in mental health and healthcare on that piece. But with all of these technologies and innovations, then we're opening the door, or risk opening the door, to the data privacy. Everyone wanting to get into things. I mean, we've heard, the big, large companies like Facebook have data privacy issues. They've had breaches. Large hospitals have had breaches. I mean, multi-billion-dollar hospitals have had tech breaches, things like that. And this again is mental health, substance abuse, highly private information that needs to be protected. So making sure that you have that data privacy in place is another part. And I will share it's one of the many reasons why many providers that I talk to are not yet using as much technology as they could, because they're scared about, where's this information going, who's getting this information, how is it being impacted. How can you protect that an AI is not going to share my information with somebody else in somebody else's session and go, oh, Well, Wendy Danacourt, who lives in Florida, she talked about having depression, and she's had depression all of her life because, I don't know, she moved 20 times before she graduated high school, things like that. How are you going to protect that? And that's a challenge because the people creating the technology isn't always understanding all the nuances. So it's important that when you look at that, who's developing that and who's in charge of that. Um, but I will say that many innovations are also working that we have and we have access to have helped us, have helped our workforce and our workforce resilience of um, documentation, being overworked, scheduling, being able to help people, seeing more people get help. So that's an important part. Our workforce resilience technology lets us get the latest data out there to providers and share information about what's being seen globally, what's being seen in their region, what's working in their region, what are some of the up and coming things. So it gives us hope as a workforce entity on that. How am I doing? Okay. So yeah. So the ethical, safe AI, cybersecurity and confidentiality, don't forget that. Very important. Preventing burnout. I will say, I came across an AI app that monitored staff and their work and their language speak, and it could actually identify when a staff member was getting burned out so that the entity could, the leaders of that staff could intervene before a burnout occurred, which I thought was pretty cool. But then I had all sorts of questions about privacy and safety and the data on that. So, in the policy and advocacy, again, I encourage anyone that's working in mental health, you're already probably doing this, but accreditation informs funding. So it's one of the big reasons why I suggest people and even sole providers look at accreditation because it informs those who are funding you, whether it's self-pay, the patient's paying for themselves, or a family member's paying. This is giving legitimacy to you. But everything that you do to get accreditation can also go to the other funders, whether it's um, the government, private insurance companies, an employer as well on that. And then the parity for mental health, it's across the board. It impacts all of us. And with the data that you're getting and being a voice of what's happening, you're showing that you're holding your government, those entities accountable on those pieces, which then puts pressure on them to do what's right. Perhaps that's give you more money, give you more resources, allow you more opportunity and flexibility in what you're providing to serve on that. So I hope that some of the things that you took away from this is that accreditation standards were created to develop trust, not just between patient and provider or organization and the patients, but also with to allow the organization or provider to create trust with the communities, showing their commitment to the patient for quality and safety. And that our standards here at American Accreditation Association taking into account all the challenges that you're facing, but we created the standards in a way that can be flexible to meet your needs, but yet demonstrate the fine quality and high quality services that you provide. And that adaptation ensures relevance, is important to us at American Accreditation Association. We see how you have to adapt to what the world is like in your region and what you're faced with, and see how you're adapting, and we take that into account. We don't hold hard lines of what you have to have. We understand not everyone has electronic health records, that there are paper records. We understand that not everyone has the same resources across the globe. So we take that into account when we're working with you on your accreditation as well. Another one is that innovation drives change. I think that we've all seen that, especially since COVID time, that we're looking at change and being innovative, and we applaud individual providers and practices that are being innovative, and we love being part of that innovation and having conversations of how you can incorporate that if there's any concerns on that piece. As I said, working with one entity that is doing AI. And with that, there is a lot of conversation about patient safety. How are we monitoring it? And they're bringing the right people in. So while it's bringing in the change, it's bringing also looking at how do we promote safety and ensure that it's going to do what is best on that innovation. So we appreciate being brought in early so we can take into account and seek the advice of the experts if we're not the experts. Like with the AI and the questions that we had, I spoke with a couple of technology people because I wasn't sure on the technology aspect how it would impact and what it would look like and what are key things to ensure safety. So we brought those individuals in to help write those portions of the standards. And then policy ensures stability. So having a policy not just within your own organization and system, but policy within your region as well. But you can only control what you control. So you have your own policies, and that just supports sustainability and looking at that. So you put all of those together with accreditation, and we're here um, to support you. To we don't like to think of ourselves as policing or investigators of looking at everything that's what's wrong, but what are you doing right in this world of uncertainty and helping individuals with a very complex issue in the mental health world. So, if you're interested in American accreditation, whether it's through our accreditation process and becoming accredited, or partnering with us on how you can promote the accreditation in your area, contact us. And the best way to do that would be to just go on our website, www.aaa-accreditation.org. Um, and there's a contact page information. You can see all the areas that you can contact us, or you can email us at info at aaa-accreditation.org, and that they will make sure that it gets to the right place on that piece. And again, we offer the accreditation in healthcare, but we also look for people that we can partner with in different regions of not only promoting accreditation, but well-being for patients and safety and quality on that. All right. Thank you, everyone. Have a wonderful day.